This is BayRadio.
I'm Jeremy Kenton. The expected baby boom following COVID has not happened. The Royal College of Midwives were anticipating in the UK a vast increase in the number of births, and unfortunately it hasn't happened. And in fact, the exact opposite. The birth rate, which is normally fairly high in January, February, is actually lower than expected, which has prompted concern as to whether or not the population levels are going to be artificially lower because of COVID. Some people are suggesting that as divorce rates increase, as people have been trapped indoors with spouses and partners that they didn't want to be with, that this could be one of the reasons why the expected raise in birth rate has not happened. Most children don't become seriously unwell with COVID-19, and despite increased rates of infections in children over the autumn, school children and adolescents who tested positive were fairly low, but between 1 and 5 children in every 100,000 need admission to hospitals for COVID-19, and even fewer of these require admissions to an ICU unit. But there is a concern that a very small percentage, a very small proportion, and I do stress that it's small, may be suffering from paediatric multisystem inflammatory syndrome, or PIMS for short. Now, this is a very rare condition affecting less than 0.5% of children who have or have had COVID-19, and most children will not be seriously affected, but in a very small number of cases it can be serious. And children and young people who are affected will have some symptoms which are very similar to other life-threatening conditions such as systemic sepsis or meningitis. Doctors in the UK first started to see children suffering from PIMS in April of 2020, and studies have found that the overall picture of this is that children with PIMS will have a high fever over 38 degrees, which will persist over several days, with other symptoms including stomach pain, diarrhea, vomiting, a rash, cold hands, feet, and red eyes. And the red eyes are a classic feature to look for and watch out for. And obviously the advice is, if your child is ill, phone immediately for assistance. Don't leave it. Don't wait to see if things are going to get better. And studies have found that up to 28% of adult patients hospitalised with COVID-19 have also developed heart effects, usually myocardial damage, although most of these adults had pre-existing heart problems before. A study from the University of Edinburgh has found abnormal changes to the way the heart is working in over 55% of patients with the virus who were examined, and with 1 in 7 showing severe dysfunction. These issues are compounded by the cardiovascular health risks that have been made worse by the unusual lifestyle changes that people have had during lockdown, as people are beginning to basically eat absolute rubbish. The COVID-19 pandemic has caused exponential growth in heart disease, and this is expected over the next few years. And it's known that COVID-19 can cause heart damage, but also it is causing issues where patients are delaying care for heart problems and stroke by not attending for hospital appointments, or by hospital appointments being cancelled.